What imaging tests are used for seronegative RA? When it comes to seronegative rheumatoid arthritis, or RA, diagnosing and monitoring the condition can be a bit tricky. This is because, unlike other types of RA, seronegative RA does not show typical blood markers like rheumatoid factor or anticyclic citrullinated peptide antibodies. So, how do doctors figure out what's going on? They relying heavily on imaging tests to reveal joint inflammation, damage, and other changes that might not be visible through blood tests alone. One of the first imaging tests often used is X-ray. X-rays are a common starting point for assessing joint damage. They help identify issues like bone erosions, joint space narrowing, and osteopenia, which is a softening of the bones near inflamed joints. However, it's important to note that X-rays may not show any abnormalities in the early stages of seronegative RA. They are more effective for tracking how the disease progresses over time rather than for early diagnosis. Next up is ultrasound. This imaging technique is incredibly useful for detecting synovitis, which is the inflammation of the joint lining. Ultrasound can pick up on issues that X-rays might miss, such as early bone erosions and subclinical inflammation. It is non-invasive, widely available, and allows for real-time assessment of joint inflammation and soft tissue changes. This makes ultrasound a preferred tool for early diagnosis and monitoring of seronegative RA. Another powerful imaging tool is magnetic resonance imaging, or MRI. MRI provides detailed images of both bone and soft tissues, including cartilage and tendons. It is more sensitive than X-rays and ultrasound when it comes to detecting early joint inflammation and bone marrow edema, which indicates active inflammation. MRI can also help differentiate seronegative RA from other joint diseases, especially when clinical symptoms suggest RA but blood tests come back negative. High-frequency ultrasound is another advanced technique that has gained attention in recent studies. It enhances the visualization of synovitis and bone erosions with greater resolution. This can aid in the early and accurate diagnosis of seronegative RA, helping to differentiate it from conditions like osteoarthritis. It's important to remember that imaging is just one part of a comprehensive diagnostic approach. Doctors will also consider clinical evaluations, medical history, and laboratory tests. Since seronegative RA lacks specific blood markers, imaging findings combined with symptoms such as joint pain, swelling, and stiffness are crucial for making a diagnosis. Additionally, imaging can help rule out other causes of joint symptoms, such as osteoarthritis or other seronegative rheumatic diseases. For the best interpretation of imaging results and overall management, a referral to a rheumatologist is often recommended. In summary, X-rays, ultrasound, including high-frequency ultrasound, and MRI are the primary imaging tests used to detect and monitor seronegative rheumatoid arthritis. Ultrasound and MRI are particularly important for identifying early joint inflammation and damage that X-rays might miss. These imaging modalities help compensate for the absence of serological markers and guide diagnosis and treatment decisions. Always consult with a healthcare professional for personalized advice and information.